Warm compress or cold compress? Which do you prefer? Cold compress can also be called cold therapy. Warm compress also known as warm therapy. Why should this particular modalities separately? Warm compress basically helps to relieve chronic pain, helps to improve circulation, and helps to relax the muscles. Because all this English basically means that when you use cold warm therapy, your body feels more relaxed. Now, take for instance when you decide to be to hot water. Whenever you pour that hot water, first about hot water, you feel so relaxed and refreshed. That's what warm therapy does for you when you put it on the skin for about 15 to 20 minutes. It gives your body a soothing feeling that makes you just relax and allow the worries. For what cases should you use this particular injuries for? First of all, I would say do not, I repeat again, do not use it for a condition when you just get injured. That is, you're playing a football and then someone bumps your head with a ball. Do not use warm compressor. Because why exactly should you not use it? Because when you use that, if you decide to use warm compress on that particular spot, you're allowing the blood flow to increase. What does this basically mean? Now, when you use warm compress, something is happening to your body. Your veins are being dilated. It basically means your veins are opening up. And when they open up, blood flow is rushing faster than normal. Now, if we decide to use warm compress for someone that gets injured and bumps the head, you're allowing blood flow to pack to that particular point, which will lead to more swelling. So you will see again that while warm compress is good for an injury that just happens on the sports field or anywhere suddenly, or a trauma or a fall, go for cold therapy. And I will tell you the reason why you should use cold therapy also. Now, you can also use it for sport athletes. Now, let me not jump ahead of myself. Let's complete with warm therapy. For conditions that you can use warm therapy, you can use it when you have arthritis. I mentioned it before that when someone has arthritis, do not use cold. You're causing yourself more harm than good. Use warm therapy to relieve the person of pain and any swelling. When the person also has menstrual pain, science has said that menstrual pain can also benefit from this warm compress. Or back pain in general, you can also use warm compress. Like I mentioned in one of the last videos, muscle spasm, you can also use warm compress. It's a two-way thing. Like I mentioned, I know I said I use cold therapy for my sessions, but you can also use warm compress when the person and the person will feel good and better also. You can also use warm compress when the person has what we call contractures. Basically means shortening of the muscles as a result of burns or injuries that makes the skin, shrink together. So you can use warm compress at that particular point. Why would this work? Because it helps to relax and relieve the skin, make the skin softer, and then you can work on the muscles and it's more flexible. I'll talk to you about cold compress in the next video, so stay tuned. But besides that, don't forget to like this particular video, don't forget to share, don't forget to comment, and don't forget to subscribe. And I'll see you when I talk about cold compress. Warm compress or cold compress? Which do you prefer? Cold compress can also be called cold therapy. Warm compress also known as warm therapy. Why should this particular modality